The guidelines provided by the NCCN are very essential because they set the framework for appropriate imaging that has to be acquired in these patients, because not uncommonly that these patients obtain routine CT examination that would make the diagnosis of pancreatic carcinoma. However, they're not adequate for staging of the disease. So not infrequently the patients will need repeated dedicated high-resolution imaging to make sure that the diagnosis is appropriate and we have the complete information about the staging of the disease. So the NCCN provides these guidelines that what is considered to be adequate imaging, when it should be obtained, and moreover, once we get all this imaging information, how to put them in clinical context and make appropriate staging for the disease status, because that's very essential in patients with adenocarcinoma. And the NCCN guidelines provide resectability status for these patients. They can be either put in a resectable category, a borderline resectable category, or an unresectable category, which makes significant impact on the patient management. The resectable category can go directly into surgery, whereas the borderline resectable category may necessitate systemic therapy before they can go to surgery, whereas the unresectable category, they should be spared the surgery and its complications because they will not gain any benefits from that surgery. So in the guidelines, we have all these information from the appropriate imaging to the all clinically relevant information present from imaging to be appropriately place the patients in each category and then decide on the treatment.